20 million Americans take this one small capsule. Most started it for burning feet, or for nagging back pain, or because someone whispered it might help you sleep. In November 2024, a study published in JAMA Network Open reviewed the records of frail older adults on this exact pill. And what the researchers found made hospital pharmacists across America rewrite their protocols overnight. Because the third finding I'll share with you tonight, it isn't just surprising. It's the reason your hip may already be at risk right now, and no one has told you. I'm Dr. Ember. I'm a health educator focused on senior wellness, and I've spent years studying the research that gets buried inside academic journals, the studies your loved ones will never hear about at a 15-minute appointment. What I share with you at the 14-minute mark of this video changes everything about how a family should think about pain medication after 70. And stay with me until the end, because the most important finding, the one that made me sit down when I first read it, comes near the very last section of what we cover today. Let me start with a picture. Imagine your entire nervous system is a house. Every room has a light. The kitchen light guides your feet at night. The hallway light keeps you steady when you turn a corner. The bedroom light lets you find the bathroom without falling. Gabapentin and its cousin pregabalin, sold as Lyrica, was designed to dim one flickering bulb, the one in the back room where the nerve pain lives. But here is what the manufacturers didn't put in the commercials. That pill doesn't have a targeted switch. It's a whole house dimmer. When you swallow it, every light in every room dips at once. The kitchen, the hallway, the bathroom, your inner ear compass, the tiny organ that tells your body where the floor is, it dims too. Your ankles and calves, the small muscles that catch you when you stumble, they lose their tune, like a violin string with the tension slowly loosening. So the nerve pain fades. And so does your ability to know exactly where the ground is beneath your feet. In a person of 40, the body compensates. In a person of 72, especially one with tired kidneys, it does not. And that is where the story turns. Here is what most physicians will tell you when they hand you this prescription. They say, don't worry, it's not an opioid. And that is true. It is not. But that single sentence has cost tens of thousands of older Americans their independence. Because gabapentin is a central nervous system depressant with a fall signal comparable to some sedatives. And there is a 4-second test you can do at home tonight, standing beside your kitchen counter, that will tell you whether your body is already sending you a warning. I'll teach you that test in point 4. So here is what we're going to cover together step by step in the next 17 minutes. 5 findings. Every one of them drawn from published research. Every one of them the kind of thing you wish someone had told your father, your husband, your wife before the first fall. And near the end, one participant pattern documented in the study, one sentence from that research that stopped me cold. I promise you, you'll want to write it down. Type the number 1 in the comments right now if you or someone you love takes gabapentin or Lyrica. Just the number 1. So the algorithm knows this video needs to reach another family before their fall. Point 1. What this pill actually does to a 70-year-old brain. Gabapentin works by binding to a tiny piece of your nerve cells called the alpha-2 delta subunit. In plain English, it blocks the little gates that let calcium flow into nerve endings. Fewer signals leave the nerve, so the burning feet quiet down. So the sharp back pain softens. That is the intended effect. But those same gates aren't only in the pain nerves. They are everywhere. In your balance nerves, in your cerebellum, in the tiny muscle fibers of your inner ear. The JAMA Network Open study from 2024 documented what happens next in older adults. Sedation ataxia, which is a fancy word for wobbly walking, and orthostatic dizziness, which means the room tips when you stand up. In a healthy 25-year-old, the body compensates in half a second. In a 75-year-old, that compensation is delayed, sometimes by 2 seconds, sometimes by 4. And in those 2 to 4 seconds, the person is falling. Now, here is where the numbers matter, so listen carefully. The researchers found that older adults dispensed gabapentin had a 30% higher chance of a hip fracture within just 2 months. 30%. 30%, that is not a small number. That is not background noise. That is the difference between walking into next Christmas and being wheeled into it. And here's the part that made me pause. The signal was strongest in the first 8 weeks, not year 1, not year 3. Weeks 1 through 8, the exact window where the physician says, give it time to work. Imagine what that means. You are given a new pill on a Tuesday. By the following Tuesday, your body's alarm system for the floor is already muted. And nobody warned you. Point 2. Why your kidneys turn this pill into a booby trap. Gabapentin is cleared from your body almost entirely by your kidneys, not by your liver, not by enzymes, by your kidneys, filtered out into urine. And here is what nobody tells the average senior. After 65, kidney filtration drops. Not because you did anything wrong, simply because kidneys age. By 75, the average person filters at about 60% of what they filtered at 30, which means the same dose that was safe for your 50-year-old neighbor becomes a slowly rising tide inside your body. Every dose adds a little more. And the pill you took on Monday is still working on Friday. In the JAMA study, patients with chronic kidney disease, even mild kidney disease, had more than double the hip fracture risk of everyone else. More than double, and here is the trap. Most physicians order a standard blood panel, see a creatinine of, say, 1.1, and say your kidneys look fine. But at 78, a creatinine of 1.1 is not fine. That number needs to be converted into an eGFR estimated glomerular filtration rate and adjusted for your age and body size. If your eGFR is below 60, your gabapentin dose should be lowered, sometimes cut in half, sometimes cut in quarter. And nobody thinks to check unless you ask. So here is your precise action if you take this medication. Pull out your last blood test. Find eGFR, not creatinine eGFR. If the number is under 60, that is a physician conversation this week, not next month, this week. Because a rising tide of gabapentin in an aging body doesn't announce itself with a warning label. It announces itself with a bruised hip on the bathroom floor at 3 in the morning. And nobody in the emergency room ever traces it back to the pill. Before we go further, if this is landing, type the number 1 in the comments, not for me, for the algorithm. So this video reaches the next family before their fall. Point 3. The window where danger lives. Remember our metaphor. The whole house dimmer, every light in every room fading at once. Well, here is the part I didn't tell you yet. There is a third picture that captures this even better. Imagine a security guard patrolling a large building. His job is to detain every visitor and check them at the door. That is your brain keeping you upright. Now imagine that guard lost the master list, the list of what a normal step, a normal turn, a normal reach for the coffee cup should feel like. He still stands there. He still tries. But he has no reference. The first 2 months on gabapentin are exactly this. Your balance system has not yet learned how to compensate for the new fog, and this is what the JAMA researchers documented. In the frailest patients, the ones with a hospital frailty risk score of 5 or above the odds of a hip fracture within 8 weeks were 75% higher than in matched controls. 75%. 7-5, and I want to sit on that for a moment. Because most people, when they hear this drug is dangerous, imagine the danger years down the road. Cumulative, slow, but that is not what the data shows. The data shows a spike, a window. Weeks 1 through 8. if you or your parent has been on gabapentin for less than 2 months. This next sentence matters more than anything else in this video. You are inside the window right now. And the 4-second test I promised you, here it is. Stand next to your kitchen counter. Keep one hand hovering above it, ready to catch. Close your eyes, lift one foot off the ground, count silently. 1, 2, 3, 4. If you cannot make it to 4 without swaying badly or dropping your foot, your balance system is already compromised. That is not a curiosity. That is a phone call to your physician this week. Point 4. Now the good news. If you or your parent is on this pill, there is a precise physician-directed sequence that dramatically lowers the risk. You do not stop the medication on your own. You never stop a nerve pain medication cold. You call the office and you use these exact words. I would like a fall risk medication review, and I would like to know if my current gabapentin dose is right for my kidney function. Say it once, write it down before you call so you don't lose the words. And then ask 3 specific questions. Question 1. Given my age and eGFR, what dose is safest for me? Question 2. Are there any alternatives that don't affect my balance? Question 3. Can we schedule a DEXA scan to see the current strength of my bones? That third question is critical. A DEXA scan measures your bone density. It takes 10 minutes. It is covered by Medicare. And it tells you whether your bones can absorb a small fall or whether the next stumble becomes a fracture. Most seniors over 70 have never had one. If you have not had one in the last 2 years and you take gabapentin, this is not optional. This is the single most important preventive test in this entire video. Now, some safer options your physician may bring up. Topical lidocaine 5% patches, applied directly to the painful area. No systemic effect. No balance impact. Duloxetine 30 milligrams, which treats neuropathic pain by a different mechanism, though it has its own considerations. Physical therapy that targets nerve gliding and balance, which has shown durable pain relief in trials. None of these are one size fits all. All of them require a physician's guidance. But they exist. And most people on gabapentin have never been offered any of them because a prescription is faster than a plan. Your job this week is to ask for the plan. Before we get to point 5, comment which of these first 4 steps you are going to try first. Type it in one word. Blood, DEXA, test, review, whichever one you are committing to. One word. Point 5. The role you were never told you could play. Most families think of medication like a fixed prescription. The doctor writes it, the pharmacy fills it, and the patient takes it. But every drug in every senior's cabinet exists in a relationship with every other drug. Gabapentin plus a sleeping pill triples the fall risk. Gabapentin plus SRI, the common antidepressants like sertraline or citalopram, amplifies dizziness. Gabapentin plus a diuretic can drop blood pressure just as you stand up. And no single physician sees the whole picture unless someone hands it to them. So this week, sit at your kitchen table with a piece of paper, write every pill, every dose, every time of day, even the vitamins, even the melatonin, even the antacid. Fold that paper and put it in your wallet and bring it to every appointment, every ER visit, every specialist consultation. This one piece of paper prevents more falls than any pill. Because when the physician sees the full list and sees the gabapentin sitting next to the amitriptyline, sitting next to the diphenhydramine 3 central nervous system depressants stacked together, they can start pulling levers. Reducing one, discontinuing another, substituting a safer version of a third. And here is the truth that the pharmaceutical world will never advertise. In older adults, the single most powerful intervention is not adding a pill. It is subtracting one. Deprescribing, that is the word. Deprescribing, ask your physician about it by name. Because a medication list that shrinks safely, one drug at a time, is often the difference between a fall this year and none. Now, the finding I promised you at the start, the one that made me stop reading and sit down. In the frailest older adults documented in the JAMA, study the ones the researchers described as having a hospital frailty risk score of 5 or higher, the odds of a hip fracture within just 8 weeks of starting gabapentin were 75% higher than in matched controls. And here is what struck me when I read this. It was not a lifetime signal. It was not a 5-year signal. It was 8 weeks, 2 months, 60 days. That is faster than most families schedule a follow-up appointment. That is faster than the pill bottle empties. That is faster than a physician even knows if the drug is working. And here is what truly moved me when I read this study. The researchers noted a pattern that appeared again and again. A frail 78-year-old dispensed gabapentin for foot neuropathy, admitted to the hospital within 6 weeks with an intertrochanteric fracture. Not one case. A pattern, a shape, repeated across the cohort like a signature. And what that pattern says in a single line is this: the pill did not fail. The system failed to warn the family. And that single sentence captures everything, because the drug does what it is designed to do. The system is what leaves the family alone with the bruise on the bathroom floor at 3 in the morning, which is why videos like this one exist, so that the family gets the warning the pill bottle never carried. Here is the truth I want you to carry with you tonight. In older adults, medications are conversations, not prescriptions. Every pill is a question your body is answering. Sometimes the answer is relief. Sometimes the answer is a fall. And the only way to know which one is coming is to keep asking out loud with your physician at every visit. Silence is not safety. Silence at 70 is the ground rising up to meet you before you are ready. Let me leave you with the 5 findings cleanly so you can share them tonight. 1. Gabapentin dims the entire nervous system, not just the pain nerves, and that dimming affects balance in a way that a 70-year-old body cannot compensate for the way a 30-year-old can. 2. This pill is cleared by your kidneys, which slow down with age, so a dose that was safe in your 50s becomes a rising tide in your 70s. Ask for your eGFR. 3. The most dangerous window is the first 2 months, when the odds of a hip fracture climb by 30% overall and by 75% in the frailest older adults. 4. There is a 4-second balance test you can do tonight, and there is a specific script for calling your physician, fall risk medication review, kidney adjusted dose, DEXA scan. 5. Safer alternatives exist: lidocaine patches, duloxetine, targeted physical therapy, and Deprescribing itself is the most powerful intervention that no one talks about. And if all of this feels like too much, I understand. So pick just one. If I had to choose one action for you tonight, it would be this. Pull out your last blood test tomorrow morning, find the number labeled eGFR, write it on the top of the prescription bottle, and when you next speak with your physician, even by phone, read that number to them and ask, is my dose still right for this? That is it. One number, one question, one conversation. That single conversation has prevented more hip fractures in the published research than any single pill I could ever recommend. And it costs nothing. It is a phone call. Please, tomorrow, make it. If this video helped you, or if you can think of one family who needs to hear it, please share it. That is how families get the warning the pill bottle never came with. Comment below with the one word, the action you are going to take this week. Blood, DEXA, test, review, subscribe to the channel, because next week I'm covering the specific antidepressant that doubles the risk of falls in seniors, over 70, one of the most prescribed drugs in America, and one nobody is warning families about. And if you missed it, watch my last video on the 5 medications that quietly damage the aging heart. It is linked below. Every video on this channel is here for one reason: to give families the warning nobody else does. A quick note before we end. I am a health educator, not your physician. Nothing I share on this channel is a prescription or a diagnosis. It is research translated for families so you can walk into your next appointment with better questions. Never start, stop, or change a medication based on a YouTube video, including this one. Please always consult a qualified healthcare provider who knows your full medical history before making any changes. What I share here may help you manage your health more thoughtfully. It cannot and does not replace the physician who examines you in person. Thank you for spending this time with me tonight. Stay safe, stay curious, and I'll see you in the next video.